This brings me to a good question about the symptoms that you have when you come into the office. I care about how you feel because I'm an empathetic doctor. I care about how your kids feel because I'm a parent too. Nobody likes to see kids who are struggling or having a lot of frustrations, right? But I'm not going to base my recommendations solely off of the symptoms that a patient brings into my office. And I want to explain why. Most people throughout their entire lives have determined whether or not they're healthy or they're sick based off the symptoms they see outside of their body or what they feel on their insides. And the truth is, we've been conditioned really to think like this. I want to explain what I mean by that. So when we're looking at whether or not people take medications, and we look at all the prescription drugs that are manufactured around the world, half of all of those prescription drugs are actually consumed by Americans. We also pay for that privilege. So when we rank the top 10 nations for healthcare spending, that's how much you're paying out of your pocket for healthcare, we rank number one amongst all nations for how much we pay per person for healthcare. Now, that might not be a surprise to you. We know healthcare is expensive, but what you might not know is that if you were then to take the citizens of countries 2 through 10 and add up how much they spend on average, you're still paying more. That's right, add up 2 through 10 and you still have more expensive healthcare. So if we're taking all the drugs and we're spending the most amount for it, we probably get really good health outcomes, right? No, that's not true either. In fact, when we look at the ranking of industrialized nations and healthcare quality outcomes, so I'll put in maternal mortality rates, like how well we take care of our moms. I'll put in infant mortality rates, how well we take care of babies. The United States averages out at around 37th out of 40 countries. I always say, listen, if we finish 37th in the Olympics in basketball, this country would lose its mind. But this is how we're taking care of each other. And I gotta say that if what we're doing right now is healthcare, we've got a failing system. In fact, when we look at a continuum of health, the thing that I want to emphasize to you is that for a lot of people, as I mentioned, they judge whether or not they're healthy based off of whether or not they see symptoms. And so I'm going to say on one side of it, they are looking at themselves as being like in this red zone. But I would say that there's a bit of a yellow zone where people are maybe not showing symptoms, but they aren't really healthy. They aren't living well. Can I give you a good example of this? You know, the first sign of a heart attack for a lot of people is a heart attack. If you're looking at something like diabetes, there's something like pre-diabetes that is just below the number for threshold to say, hey, listen, you got diabetes. When it comes to blood pressure, there is a number that is just below what they call pre-hypertension, right? These signs and symptoms have been creeping up on somebody before they get a full-blown disease. And so my goal for myself, for my family, and for the members of our practice isn't to be in the yellow zone either. It's actually to be in what we would consider a green zone of wellness, where their body is functioning the way it's designed to without interference. And so that brings me to the conversation we have about nerve dysfunction.